So today we're going to be presenting on salmonellosis, and your presenters are Kayla Coronado, Eileen Soto, Rachel Martin, and Brianna James. So today we're going So salmonellosis is caused by Salmonella enterica, which is a motile gram-negative rod that is very sensitive to acid. Due to this sensitivity, a person would have to ingest millions of these salmonella cells in order to cause any damage. However, once these millions of cells have survived the acidic environment of the stomach, they work by attaching themselves to surface receptors of the epithelial cells of the distal small intestine. Once these cells are in contact with one another, the type 3 secretion system is turned on, and now the effector proteins of the Salmonella bacteria are inserted into the epithelial cell. Because of this transfer, the bacteria is able to enter the epithelial cell through endocytosis. From here, the bacteria either multiplies within the phagosome and leaves that phagosome through exocytosis, or they leave the phagosome early on and multiply within the cytoplasm of the epithelial cell instead. Once the bacteria is released from the cell, the inflammatory response is activated and the macrophages and neutrophils attack. Due to this, most of the macrophages are killed, however, the infection also remains localized in that one area of the small intestine. Now, not all Salmonella bacteria cells invade the surrounding epithelial cells. The ones who do not invade the cells work by using the inflammatory response caused by the other bacteria to their advantage. These cells do this by feeding off the tetrathionate released by the neutrophils. This tetrathionate is good for the Salmonella bacteria because these cells use it as a terminal electron acceptor for their anaerobic respiration, while the normal intestinal microflora cannot use it and have to ferment instead. Because of this, the Salmonella bacteria are in better fighting shape because they have more metabolic energy than the surrounding intestinal microflora and therefore have a competitive advantage.
Salmonellosis is a bacterial disease that affects the intestinal tract and is spread by fecal-oral route. So there are three ways that humans can acquire this disease, and it's by either ingesting contaminated water and food, direct contact with an infected animal, or person-to-person contact, which is rather rare. And then some of the environmental factors of salmonellosis is that the water soil can be contaminated by animal waste. So some of the signs and symptoms of salmonellosis is gastroenteritis, which is basically just a fancy word for food poisoning, and it causes diarrhea, abdominal cramps, nausea, and vomiting. And then some of the more severe forms of salmonellosis is enteric fevers, and that has an incubation period of about 10 to 14 days. But the basic symptoms usually occur within 6 to 48 hours.
There are a lot of illnesses that cause diarrhea, cramps, nausea, and/or vomiting, so doctors have discovered ways of differentiating them. Salmonellosis is initially diagnosed by testing a sample of blood or stool, and then it is cultured to see if the specimen grows. And if it does, then it.
So how serious is salmonella? Normally it's not an infection that raises a lot of concern for people. It usually just results in discomfort, pain, and exhaustion for a couple of days. However, under the right circumstances it can be deadly. The very young and the very old are the most at risk due to their developing or compromised immune systems. The massive amounts of water lost during this infection could also be enough on its own to turn this infection deadly. Severe dehydration can cause cell damage, which increases the accumulation of waste around the cells. This can cause organ damage, which leads to organ failure, and eventually death if left untreated. There are a few treatment options available for this infection. Overall, the main treatment is to replenish fluids and electrolytes, which help prevent the person from going into a state of severe dehydration. They can replace fluids by drinking water or sucking on ice chips. If a child is infected with salmonella, it is recommended to replace fluids and electrolytes with Pedialytes, which is an oral electrolyte solution. Adults can also use this to rehydrate their bodies as well. There's also the option to give the child Tylenol only under the circumstances of a fever. Otherwise, it is recommended to simply let the infection run its course. In special cases, someone infected with Salmonella may need to seek medical attention if they have a weaker immune system. This includes infants, elderly, or the immunocompromised. As previously stated, rapid water loss can cause death in these groups of people if not treated in a timely manner. Doctors may use or recommend antibiotics or antidiarrheals to limit the water loss. Anyone should seek medical attention if the symptoms get worse. Hospitals offer a quicker form of rehydration through IV fluids, which may be more effective than the oral rehydration. Of course, there are some downsides to these treatment options. The main treatment for Salmonella is rehydration, but if you've ever had the stomach flu or Salmonella itself, you know how hard it is to keep anything down, water included. It's recommended to take in small quantities and to do so frequently to try and rehydrate the body. The person may need to receive fluids through IV if orally doesn't work. Another option mentioned includes antidiarrheals or anti-motility drugs, which obviously treat diarrhea in an attempt to limit the amount of water lost. While these are recommended, the use of them may prolong the diarrhea, so only use if recommended by a doctor. The same concept goes with antibiotics. They are used to help subdue the infection in the body, but is only recommended to use these if told to do so by a doctor. This is because sometimes the use of antibiotics in this situation can actually prolong the infection and may even cause it to relapse later on. There are also some strains that are now becoming resistant to antibiotics, so there's a chance the antibiotics won't even help in the first place. With this all being said, the biggest recommendation found was to simply let the infection pass if you are an overall healthy individual.
So some fun facts about salmonellosis are there are over 2,300 serotypes of bacteria. Typhimurium and enteritis are the most common in the U.S. They account for half of all human infections. Very recently, Typhimurium DT104 has emerged, and scientists have found that it's very resistant to many antibiotics. Salmonella was